Well, welcome. This is Pelvic Floor Health and Cycling, and I'm Victoria.
And I'm Lara.
We'll introduce ourselves a little bit more, but I just wanted to start by saying that this topic, pelvic floor health, the United States is very behind, and our goal is to introduce you to pelvic floor health because it is integral to overall health. And especially, we want you to feel that if you're having any areas of discomfort or dysfunction, that you're not alone. And we want people to be able to talk about this openly. If you can just tell one person about something that you're experiencing, it takes a lot of weight off of your shoulders. And Lara and I are both people that you can talk to, and we'll respect you, and we will try to bridge the gap between what you're experiencing and what you can experience, which is health. So, welcome. Do you want to hit that?
Yeah.
All right, I'm Victoria. I'm here today. I'm a bike fitter from Befitting Bicycles. I do anatomical bike fitting. That means that I do an intake with you before you get on your bike. I go through a 22-point checklist of physical assessments where I look at bone structure and range of motion and asymmetries and support your body on the bike so that you can achieve your goals, whatever that might be. And the reason that I'm here talking about pelvic floor health is it directly impacts saddle comfort. We'll get more into it later, but hi, I'm Victoria, I'm a bike fitter, and I'm happy to be talking with you today.
Hi, my name is Lara. I'm a physical therapist. I've been working for over 10 years now. I see orthopedic injuries as well as pelvic health issues in general. So I'm also excited to be here today. I am not a cyclist at all.
That's okay.
But that's why you're here.
Yeah, that's why we're doing it together. Oops. There we go.
Okay.
What we're going to learn today. What is the pelvic floor? At this point, it feels a little bit like a buzzword. You've seen it in our advertisement. You've heard me say it probably 100 times already today. We want to know what we're actually talking about, and Lara's going to do a little pelvic demonstration to talk about it. The next is why it affects athletes. That's the part that hasn't been bridged yet for cycling, but it affects athletes in many ways, and we want to take away the mystery. So we will dive into that after Lara's done the basis of pelvic floor, healthy pelvic floor, and then we're going to add in that athlete part. We're going to learn what's healthy and what's dysregulated. What should you be looking out for? What might you be experiencing? Steps for a healthy pelvic floor. It ranges from simple everyday things you can do all the way to possibly seeing a pelvic floor physical therapist. There's so many steps in between. We're going to talk about that. And then matching pelvic floor health for athletes. That, again, is we're taking this concept that everybody has a pelvic floor, and we're going to learn about the health, and then we're going to talk about what's going on when we're cycling, what happens to the pelvic floor, especially with endurance cycling. All right.
All right.
The floor is yours.
All right, so we're just going to start with some very basic anatomy. Okay, so when we're looking at the model of a pelvis, okay, so these two bones here would be the tops of your hips. We've got your pubic bone in the front and your tailbone in the back, and your spine is coming up through there. Okay, so these red structures that you can see here are those pelvic floor muscles. Inside this cavity would sit your bladder, your uterus, or your prostate, as well as your rectum. Okay, your abdominal muscles will come in here, We've got your glutes on either side, okay? So all of those muscles together are part of your core, as we talk about. Sometimes we can relate to these muscles as, or they are referred to as a hammock for your pelvic organs as well. So again, they sit inside this cavity here. We talk a lot about incorporating your diaphragmatic breathing with pelvic floor muscles, okay? So if your breathing is off for whatever reason, if you're going up a very large hill, that can affect your performance and the way you're doing things if these muscles are not firing correctly.
Oh, we should say this too.
Oh, go ahead.
If you have a question or a clarifying question, anything while we're talking, pop a hand up. We'd like to talk about it as we're talking about that topic. You don't have to wait until the end. This is all of our seminar.
All right, so we are going to go through just basic functions of the pelvic floor. Again, what is normal and what is not normal when we're talking about pelvic health in general. I'm going fast in this one. All right, so one of the first functions we want to talk about is that the pelvic floor can help support your body. So it, number one, helps support those pelvic organs. When you are using the restroom, it helps support your rectum when it's time to poop. It also helps support your bladder when there's any increase in pressure in your system. So that could be when you're about to sneeze or cough or laugh or jump. Those pelvic floor muscles should help support your bladder so that you don't experience any leaking issues. Okay. Another function of the pelvic floor is that it acts as a sphincter, okay? So let's say you're walking around this lovely expo today and you have that urge to pee. Those muscles should hold strong so that you just don't pee yourself. When you finally find the restroom, you sit down or you stand, and those muscles should relax to allow that pee to come out, okay? So that's that sphincter control of those pelvic floor muscles. Another function is a sexual function, okay? So the pelvic floor muscles contribute to arousal as well as performance, okay? They also provide tone for the vaginal and rectal canals. And the pelvic floor also, as we talked about with peeing, when those muscles relax, they allow for penetration as well. Another function is stability in general. So we had talked about how all of these muscles are part of your core. So the pelvic floor, your abs, your glutes, they're all part of your whole stability system. So they help unload your spine to be able to do functional activities throughout your day. And then it also allows for any increase in pressure. So when you are on your bike and you're going at full speed, those muscles help keep you stable to avoid any other sorts of aches or pains and things like that.
That's a lot.
To add. It does a lot. So therefore, there are a lot of things, unfortunately, that can go wrong when things aren't working optimally. Some of those signs and symptoms would be any sort of pelvic pain in general. So pubic bone pain, tailbone pain, hip pain, back pain, anything like that could be a sign of a pelvic floor dysfunction.
Lara, if someone was a healthy, active person and had chronic back pain at the age of 30, would you think that that is possibly pelvic floor dysfunction?
It definitely could be, and I think it's worth exploring for sure. I've had a lot of patients in the past that have had a chronic back or hip issue, and they've been to regular physical therapy, they've seen their providers, they've had imaging, and nobody can figure out what it is. And we do a pelvic floor exam, and that reproduces their pain. Yes?
What's the likelihood that pelvic floor dysfunction could present itself as an issue with the SI joint, the sacroiliac?
Yeah, I mean, all of those areas are connected. So your SI joints, if you turn this around, are these joint spaces right here. So that's very closely related to pelvic floor in general. So yeah, I mean, it's worth exploring for sure. It's not like a definite yes or no, but yeah, definitely, yes.
How does itching work? What would be itching?
Oh, I mean, you're gonna
any type of genital itching. Honestly, soft tissue, anything that you would cover when you go to the beach.
You mentioned the glutes and some other hip stabilizing muscles. Would you say like maybe chronic instability in the hips could lead to like more like insidious onset of pelvic floor issues, or is it a precursor typically, or is it kind of a chicken and egg kind of situation?
Yes, the latter for sure. I think sometimes, again, if it is a chronic, let's take chronic hip pain, for example, was it the hips in general that then caused pelvic floor issue, or did you always have an underlying pelvic issue that then led to the hip? So
I think it's also probably a good time to note that muscles only have the function of contract and relax, and they have to work with the other muscles to make the movements of the body. So that chicken and the egg, it's sort of, did one get tight and one loosened up, but because they couldn't move together, sometimes that is, I see it even just in the stabilizers and the glute max and the glute med. The front and the back, they need to both be firing healthy. And it sounds like being a sphincter and being something that holds other organs, if something's too tight, it's gonna throw that out of whack.
Oh, yeah.
Do you want to go through? We touched on a couple of these, but it looks like a couple of these we haven't talked about, like constipation.
yeah, so constipation can have many, many different reasons why somebody is constipated, but one of those could be pelvic floor muscles themselves are too tight. So when they are too tight, they have trouble relaxing to allow anything to come out. That also relates to the pain with sex. For the most part, people that have pain with sex, it's because those muscles are so tight. And any time something's trying to go in or out, it causes that pain.
I think you touched on everything else on here. There we go.
So these are just some common diagnoses that I see as a pelvic health physical therapist. So one of the most common is urinary incontinence. So that can be in two different forms. The first one is stress incontinence. So that's when you pee when you cough or sneeze or jump. And then the other one is urge incontinence. And that is when you get an urge to pee and on your way to the bathroom, it just comes out. You can't quite make it to the bathroom. I've had so many people over the years that just because they've had a child, they think, oh, of course I pee when I jump on the trampoline with my kid. It's normal. Not normal. And then similarly, as people age, they say, oh, I'm above the age of whatever, and when I put my key in the door, I immediately have to pee, and sometimes I pee myself. So all of these things are not normal just because you're aging or just because you've bared a child. So these are things we can work on.
And they're not normal for a healthy pelvic floor, but a lot of people deal with those problems. So if you are dealing with it, that's not normal, but it is common. So
Yes,
you're not alone.
It's common.
I always like to remind, because again, when people come into my studio, it almost feels like they're embarrassed to talk about some of these things. And I always want people to know that I hear those things all the time. You're hearing some of the same things.
Yeah.
All of the time. And you don't have to think that you're the only one dealing with these problems.
The sexual dysfunction, the pelvic pain we touched on a little bit, but again, people that complain of pain with sex, again, difficulty with arousal, those kinds of things, those could be a pelvic floor issue. Again, thinking more on the side of too tight, everything is in this, we call it a hypertonic state. So we focus a lot on stretching and relaxing and massaging those muscles to get them back to their more adequate state so that they can relax as well as contract. And then the last very common thing I see a lot of is a pelvic organ prolapse. So a prolapse is when those pelvic organs start to descend into the cavity. That can happen for many reasons, one of which is these muscles themselves become quite weak. So they cannot support those organs up in the cavity. So a lot of times people will say, oh, I feel a heaviness in my pelvis, I feel a lot of pressure down there, or sometimes people often say it feels like a tampon is stuck in there. So those all could be signs of a pelvic organ prolapse. So working on retraining these muscles as to how to properly contract, so how to squeeze in, but also how to lift, right? That lift function is what helps keep everything up where it should be. So those types of things we work on exercise-wise in physical therapy.
Whew. Yes.
I learned recently that some people experience the difficulty emptying the bladder, not with feeling that they're not emptying the bladder, but have it presenting in other things like frequent urgency to go, things like that. Could you speak to that a little bit, please?
Yeah, so with any complaints that people come in for, I get all their background information, and then what I do is an internal exam with the patient if they're comfortable with that. So number one, the first thing that I do is I kind of touch on all of these things. So first thing I do is feel the quality of these muscles. So is there any tenderness? Is there any pain? Is there any tightness that I can feel? And then while I'm in there as well, I can test their strength. So have you do a Kegel, if you guys have heard that term, that's a pelvic floor contraction. And then I can see what exactly is happening to these muscles. So because it can be for a variety of reasons as why those people have those issues, I get a baseline exam and then I can determine, okay, is it more of a tightness issue that's causing them to not be able to empty their bladder? Is it more of a weakness issue that's causing that? So then from there we develop a plan of care. So it really depends. Some people the muscles are too tight and they can't relax to empty. And for some people it's just they're too weak and they don't have that tone to be able to do that. So it depends is the answer.
Okay. All right, ready to move on?
Yes.
Okay. Why does it affect me, an athlete? For this one, I am going to cheat a little bit and use my notes because there's a lot of statistics that I want to make sure I don't mess any of them up. But ways pelvic floor dysfunction affects athletes. The first and foremost is urinary incontinence. It affects 45.1% of women athletes. Asterisks. Those are only the athletes who are admitting that they have some dysfunction or disclosing that they have some dysfunction. That is important, and I will touch on that again. 92% of female athletes never report their symptoms of pelvic floor dysfunction. Nobody wants to talk about peeing themselves. I can tell you that you're not alone, and I can tell you how common it is, but when you're in front of me, you're still not necessarily going to want to say, I pee myself. It's okay, but it's hard then to get a good look at the population. The urinary incontinence, I wanted to touch this again. There's the stress urinary incontinence. There's the urgency urinary incontinence, functional urinary incontinence, and overflow urinary incontinence. So if you have 4 different topics under urinary incontinence, it's prevalent. If you're feeling dysfunction, you're not alone. 1 in 4 women in the US has had 1 or more pelvic floor dysfunction. You can have multiple throughout your lifetime. And men, you also experience pelvic floor dysfunction. I have a client who he was going to stop riding because he went to the urologist because he was peeing blood. A lot of times we don't know about a male's pelvic floor dysfunction until it gets to that extreme point. But I do, on the screening sheet, it is not just for women.
Go next.
I'm gonna actually put this down for a second. I just wanted to touch this again. 1 in 4 women in the US has had 1 or more pelvic floor dysfunctions, but that's only the people who've gotten treated. I know many women who've had children, and I ask every single one of them, did you do any pelvic floor therapy after you had your baby? And 0 of them have. It wasn't offered to them as typical care. That's a problem. Because then their kid is 3 and they're jumping on the trampoline.
And they're paying themselves.
Yes. When you're an athlete, I often see women get back to training without rehabbing from the trauma of childbirth. If you've never had a child, there are still many other ways that the pelvic floor can tighten or loosen in a way where it's not working with the full core. Most susceptible athletes are runners because it's high impact. You're basically jumping on a trampoline for 10 miles. Triathletes, same thing, but now we're adding the bike where we're putting a lot of pressure just on our pelvis. Endurance cyclists, high intensity interval training because it's usually a lot of jumping and squatting all together and not a lot of stabilizing. And CrossFit because there's a similar way of moving. When I do a bike fit, I am collecting puzzle pieces of you. Do you stand all day? Do you sit all day? Do you drive a truck for work? Yes.
I was just going to say, I'm a commuter bicyclist, so we don't think of ourselves as an athlete. So where would a commuter bicyclist fall into that?
So a couple of things with that. One is you might be on your bicycle for more miles in the week than someone who is considered an endurance athlete, but it's broken up. You're still putting a lot of pressure on that pelvis. 2, most of the commuters I know don't wear a chamois, and they have a seam running down their pants, and they're on a bicycle, and your body will shift weight to kind of relieve. There's also instability that's possible there. I consider a commuter an athlete. If you are regularly doing something where you are moving your body, I consider you an athlete. Does that help? Okay. When I am doing a bike fit, I'm collecting pieces. I want to know who you are and what you want. And then I'm going to go through and see what your body already does, where there is need for support, and these are some key words that when I hear them, I make a note and say, possible pelvic floor. Numb feet. Numb feet means that the way that you're weighting your body, you might be trying to get away from the saddle. That also goes with hands feel heavy or numb. If you are bracing your body off of the bike because that saddle is so uncomfortable, that is a ding, ding, ding moment for me. Excessive saddle pain and chronic low back pain. I get people who will talk about chronic low back pain, not just in cycling, but in their day-to-day life. And I think you are a healthy person. You are active. You are not in any type of scoliosis, etc. You're not coming to me with an injury. Then something might not be supporting you. And the pelvic floor is often one of those pieces. Leaking or difficulty hydrating. If an athlete doesn't want to drink enough hydration, I wonder if it's because they're afraid of peeing themselves or of feeling full and not being able to let it out. If there's leaking, I want to know when, and I want to know how often. The difficulty hydrating is hard because some people maybe they don't feel coordinated enough, etc. There are plenty of reasons why, but oftentimes I find that people will not hydrate and not eat because they're afraid that they will have to go to the bathroom in the middle of a ride. Yeah.
Got it.
Thank you. Yeah.
Could you speak more to the hand numbing?
Yeah, so hand numbness is wonderful. I have the privilege of co-teaching a class with Isaac, who's back there. Hi, Isaac. At Befitting Bicycles, and every class we do one question: what causes hand numbness? And we have a board almost this size. We can fill up the board with different reasons for hand numbness. Some of it is hand position. We have the radial nerve and the ulnar nerve both coming through our hands. If we're pinching any of them, whatever, lots of things there. But it is a bracing spot where people will put their hands down and roll their pelvis underneath them. Can I use your pelvis? Mm-hmm. Thank you. Mm-hmm. Instead of rolled forward and the core is holding and the hands are placed, we've got the hands gripping and pushing us back to basically relieve being on the saddle in the front, in the soft tissue. And a lot of times that's because you're on the wrong saddle, in the wrong position, and possibly your pelvic floor or your stabilizers, that glute med, glute min, are weak or overtight. Good? Good. All right, steps for a healthy pelvic floor every day. Laura, you want to get this one?
I mean, that's tricky.
I know.
Because there's so many different things. I don't know. Hydrating is a huge one.
Yeah. So the first one, this is when you know that there is a problem. You need to see someone to help you get healthy. And that's see a pelvic floor physical therapist. When those signs of dysfunction come up, go see someone. It's easier to deal with a dysfunction that's starting to show up instead of something that you've been suffering with for years. Empty your bladder fully. My OBGYN gave me this great tip. When you go pee, and then you stand up, and then you sit back down again and get the rest out because you want to get it all out. And I don't know why she gave me that tip, but sometimes it works. But if you aren't emptying fully, you're going to want to have to go more and more and more and more, and it just snowballs. Avoid straining. Try and have regular bowel movements. This one's fun. Use good posture, sitting and standing. Do you want to get into that a little bit?
I mean,
what is good posture?
well, that's tricky. All right, why don't you face that way? You stand. Okay. So when we're looking at good posture, we want to make sure that everything is aligned. So her ears should be over her shoulders stacked on top of her hips on top of her ankles. That's the optimal standing posture. I would say most people don't have that. You know, we live in this society where we're on computers and we're driving and we're in this forward position, right? It's very difficult to do. But when you're looking at the whole body, that's what we want.
Thank you.
Yeah, you're welcome.
The other thing is breathing down here. As a cyclist, I can tell you, you will get more power if you can breathe from your diaphragm. Down here, you're filling up this balloon here. You are not up here. Oh, sorry, my mic. You're not up here. You're down here. You get more oxygen in, and you can actually slow your breathing more and control that output. Which then, deep breathing, Pilates and yoga. But I would say if you're feeling dysfunction, wait to see a physical therapist before you just decide to do your own thing. And then core and glute strength. All of those, please make sure that you're consulting someone before you just go off and go rogue. Now, if yours a yes.
Can you speak to like this cultural belief that we should like always have our core tight and how
Yeah, I hate
that can affect pelvic floor?
Yeah, I hate when I hear people say that too. Even my coworkers, they'll be instructing exercise and they just shout across the room, keep your core tight. That's not functional. You can't physically do that all day long. One thing that can lead to is more of the tight pelvic floor. If you're constantly thinking, okay, let me squeeze my butt, let me keep this tight, then you're gonna have a lot more pain issues, because that's if everything's tight all the time, it's not relaxing. You'll have constipation issues, you'll have pain in general. So I don't like that either.
I do.
Similar question,
Oh.
which is, can you talk about the balance between being too tight and having to loosen some of the muscles down there versus building up strength? Because
Oh.
I know that if you go on the internet, or if you're going to talk about that later.
Sorry, I wanted to actually take her question and connect it to something that's on the slide, so just before we lose train of thought here. When I say engage full core while cycling, I do not mean keep your abs tight the whole time. Engage full core means allowing the space to relax for that open breath. And the core is not your abs. The core is like the entire torso. We've got our spinal erector muscles. We've got the pelvic floor. We do have abdominals, and we have the diaphragm. All of those together, that is your core. So when it says engage full core while cycling, I wanted to just touch on that it's not stay tight the whole time. As for strengthening versus loosening, I think that's probably very person dependent.
Yes.
And for my purposes, I just refer to Lara.
Yeah, so I would say, again, we would look at all of the symptoms that you're having, but I want to be able to teach people when I see them how to stretch and release and lengthen, but also how to contract. So if you can do both of those things properly, then everything else should be able to fall into line.
Yes.
In a previous slide, you showed about glutes. As a cyclist, we're not working the glutes as much, so does that mean that we need to do more glute work?
As a cyclist, you should be working your glutes more than anything else. And if you're not working those glutes, you're not in an optimal position, because the quads are not as strong as the glutes. We should be engaging glutes for most of the power stroke. So yeah, so if you're not feeling glute engagement, then maybe it's the position that you're in, or possibly something else that's preventing it. But we are always, bike fit is the first thing for us. We want those glutes to be the most powerful. I'm going to talk about how does cycling affect pelvic floor muscles. Pressure on the perineum. How often do I hear someone say that they have pressure on their perineum? Most often they say it hurts down there. All the time. I couldn't even quantify. It's the number one thing that I hear, followed closely by my clitoris goes numb. Tension on the pelvic floor muscles, compressed nerves and arteries. We've got things that are coming through our pelvis that could cause an entire leg to go numb. Pelvic floor muscles might not be contracting and relaxing properly because of all of the pressure of being on the wrong saddle or being in the wrong position. And that can all lead to pain, infections, urinary incontinence, and general hatred towards bikes. Steps for a healthy pelvic floor for cycling, we've got Bike Fit. Like I just said, if you're not engaging the right muscles through your ride, then I can help you with that. 2, find the right saddle. I use a really, really, really expensive German technology. Saddle pressure mapping is the most sensitive in the in the saddle world. And it shows me where there's pressure, how your body's moving, what angle your pelvis is at, and it helps guide the saddle choice that would be the most supportive for you while being the least intrusive. Prioritize keeping stabilizers strong. Deep squats and monster walks. I tell people just blank carpet, monster walks are your friends. No one will know it. It won't do any harm to you to just add in some monster walks. That's for those stabilizers.
Can you explain what a monster walk is?
A monster walk, I don't know if I can have the space, but you're gonna squat down here and you're gonna stay nice and low, and then you're gonna add resistance bands, and again, you're gonna just do it within your means. You're never gonna go for pain. Yeah. The next one is, this is our last one before we just like open up all questions. How to support pelvic floor for athletes. I am a resource to you. I am not a pelvic floor therapist. That's why it's great that Lara's down the street from me. I need you to have a team that you trust. Are you gonna talk to, the people you ride with? Do you have a doctor that you trust? Do you have a chiropractor that you trust and then they refer you? Do you talk to anyone about what's not working? That's the first step. And then we can divert you in the right direction. Maybe you need a bike fit. Maybe the pelvic floor is pretty healthy, but it's not being supported on the bike, and you need a bike fit. Great. That's me. Maybe you need a coach or trainer to help you build up your muscles so that you can do what you're looking to do, so that we don't just clench in and white knuckle our way through our rides, building nice and slow and steady in a way that works for your body. And maybe you see Lara. You see someone who can work on that pelvic floor, and that is the full experience. We're talking how to be healthy. We're talking seeing what maybe brought on the dysfunction. But yeah, as a whole, we just want to have this conversation be open and not a taboo. The less we hide the things that hurt us, the more we can help each other. Yeah? Yes?
First of all, I want to say thank you guys for coming out. I think it's such an important topic, and as you mentioned, it's taboo, and there's kind of not a whole lot of education and space to discuss this, so that's great. This is a PT question.
Sure.
So I'm specifically curious about your experience working in athletes who have not had babies or have not had vaginal deliveries, because like urinary incontinence is common in that population.
Oh yeah.
And my understanding is that the main working hypothesis is pelvic floor hypertonicity. So I'm curious to hear, in your experience working with these athletes, if that's something that you see a lot, and if that's something that's addressed, do you see their symptoms improve?
Definitely. Yeah, so anybody can have a pelvic floor issue. It doesn't necessarily mean that you've had a baby. Yeah, so we see, and I see a lot of all of those things. So the hypertonicity, but then also the weakness category. Again, like I had said earlier, with everybody, we talk about all symptoms, we do an exam just to really figure out what is going on with each individual person. But yeah, people do really well. A lot of it is just education on what is, I hate to use the word normal, but what is normal and what is abnormal with those muscles and with their body, and just retraining the body. Okay, this is how it should be at some point in life for most people. Things were working fine, and then the dysfunction happened. So just how to get you back to doing that. So in terms of like using some exercises versus hands-on treatment versus just lifestyle changes. So we touch on all of those things in physical therapy.
Cool. And just a brief follow-up to that.
Yeah.
I think most people might be uncomfortable, getting a sort of pelvic floor exam if they're not super used to getting those types of exams. so they may be sort of falsely, or I guess, tighter than usual, purely because of the environment. So,
Yep.
like in your experience, do you find that you get a lot of, I guess, more hypertonicity than you think might actually be present? As in, maybe you examine them, you think they're tight, you teach them to relax more, and it doesn't actually help as much, or?
Yeah, for some people it just takes a little bit longer. Again, depending on their history or what, also culturally too, I think that can definitely play a role in how their body is. So there's different tools to help with those people that are on the really, really tight side. I mean, some people don't feel comfortable with an internal work or internal exam, so we can still work with them, just giving them other ideas, other ways to help in general.
Thanks.
Yeah, you're welcome.
Yeah.
I actually have a question sort of about nutrition, which is a big part of any kind of athleticism at all, or even like if you're commuting and you have an hour commute, whatever, any kind of activity. There's certain types of foods that will like irritate a bladder, for instance, combined with like weak pelvic floor. I'm assuming that would might make it even worse or more comfortable for the person. So are there any things like that we can all avoid if we have just to mitigate like any discomfort, like even just like what we're eating while we're doing our activity?
Yeah, so a lot of, vinegar-based things or tomato-based products, chocolate, alcohol, coffee, all of those are bladder irritants. So sometimes they'll make you feel like you have to pee when you don't necessarily have to. People will then start to drink less water because they know, okay, I'm gonna have to pee more. You had touched on this too. And then they're dehydrated and they're having those irritations, and then they feel like they have to pee a lot. So it's like just a really bad cycle to get into. So avoiding alcohol, caffeine, tomato-based products, vinegar, what are the other ones? Citrusy foods, those all can. I know, all the good stuff.
Another thing that I will just say that some of my athletes have started to adopt is, while it sometimes is boring, having a certain time and certain food that you eat, and you know that you can use the bathroom before you get on the, getting very regular is hard to do, but once you're there, then you'll feel like you have more space to hydrate and eat while on the bike, because you've got everything on clockwork. Basically, yeah.
I just have a recommendation for a nutritionist who would be alert to all of this. So
I have a dietitian that I like. Do you also
I have a handful. I have a list on my that we can.
love that. So
Yeah.
just in full candor, I was diagnosed with interstitial cystitis. So all the things that you mentioned about not eating has been like changing, and I love my wine, but I don't drink it anymore. And I love my morning coffee, even though it's decaf, and I don't drink it anymore. And the other thing, I found just some soothing impacts from using or drinking more alkaline water. So there are a couple that are more alkaline versus. It's been helpful.
Thank you.
Yes.
I was curious, when you go to look for a bike fitter, there's often many options in your area, like this guy provides a bike fit, this guy provides a bike fit. So
Yeah.
are there any professional certifications to look for when choosing a fitter that will take a clinical approach and have a more holistic view of not just your performance, but also your health as well?
So, yes and no.
Okay.
Yes, there are ranking certificates that exist. It's called the IBFI, International Bike Fitters Institution. There are 4 levels. Not every bike fitter has to register.
Yeah.
But the ones that do, they have certain requirements that they have to meet. Like Isaac, who just left, he has a level 4 IBFI certificate. It's the highest level you can get. He is the highest level of fitter of any broad institution. And I came into fitting when IBFI started to change some of the ways that they were doing things. I don't like the way that they're working now, so I didn't register myself. I'm still a fantastic fitter, but I don't have that certificate. There are also, sometimes there's Retool, that's from Specialized. That is more of a technician-based fitting. what I would do is 1, read reviews, and 2, see if you can talk to anyone who has gone there, and 3, see what's included in a fit. Do they talk about an anatomical assessment or a physical assessment or something where they're looking at your body as that intake before you start cycling? And what about follow-ups? Can you see them after the initial fit? Is it charged? Is it included? Things like that can kind of help guide you. Isaac and I, the only technology we use is the saddle pressure mapping pad, and we don't do motion capture. You know, we do things kind of old school, but we have it backed by like physical therapists saying, you know, going through it with us and saying, yep, you're doing these correctly. We're still not bodywork people, but that's how we inform our fit. And then we also offer certain like comfort guarantees on things, and we do include a follow-up in every level of our fit.
Thank you.
Can I add something to that too?
Sure.
Just from my own experience, I would probably ask the bike fitter what they specialize in too. Because even though you hope that bike fitters will be able to accommodate any kind of bike rider, I think that having somebody fit you who is specialized in what you're trying to do might help a little bit.
Okay. Yes.
To piggyback on that, you discussed finding the right bike fitter. How do you go about finding the appropriate pelvic floor physical therapist?
So, for me as a bike fitter, I will only give someone's name for anything, a regular physical therapist, a pelvic floor physical therapist, although you do everything, or, you know, like all of the places, if I say you should go there, it's because I've made a relationship with that person and I trust them. Aside from that.
Yeah, in general, there's not many of us out there. Sadly, there needs to be. There are, at least in the Philly area, there's a lot of pelvic health physical therapists, but many of them do not take insurance. So they are cash-based facilities. So I feel like that's usually how people end up. My company does take insurance, yay. But yeah.
Hold on. Sorry, we got other hands too.
Did that answer your question? Okay.
No, I have a good story about this because
Do you have a question? I'm sorry, do you have a question? We have.
About finding a therapist. I just went to my GP and said, I'm having this urgent continence problem. And she said, here, go get therapy. But the place I was already in therapy for a broken arm had a specialized pelvic floor therapist, but I had no idea that even existed. So you might have to ask, you know, do you have a pelvic floor therapist? And she was excellent.
I'm so glad you had a good experience. Hold on,
I have a question just about like physical therapy in general. So I've never been to physical therapy, and I feel like a lot of people I know, it's like after an injury. Is a pelvic floor exam, is that like preventative, or are there preventative things that you can do?
Yeah, it can be. Yeah, I usually see people once they have an issue, but I'm trying to get, you know, people that are pregnant or have just had a baby just to have it a routine issue, to have them come in. So yeah, we do an exam, we can talk through all the scenarios and just make sure everything is working optimally. So yeah.
And truly, I would love if my clients saw a physical therapist for pelvic floor and also for stabilizers, just early on in their journey with cycling to prevent being in a position where there's constant pain. Yes.
Oh, I was just going
Oh.
to mimic your story. Same thing. I had to go to physical therapy for lower back issues and then discuss some other issues and just check with the insurance. So they are, pelvic floor therapists are out there. You just have to seek them.
Yeah.
I had a question about compression garments. And
Yes.
that. I'm sure it does depend on the person and their situation, but I just want to know your overall thoughts on that. And then, kind of related, do you ever work with patients and clients that have connective tissue disorders like hypermobility, et cetera?
So, I'll do my answer first,
Yep.
and then you want to
Yeah.
go? Okay.
Mhm.
So compression, clothes, chamois. One, I always say, bib, not shorts. Shorts cut you right where you need to feel connected. It's not good. Bibs come up and you can actually move the torso where it needs to be. Chamois should fit like a second skin. Nothing in between you and your chamois. It's like that Jordache jeans. Nothing should come in between you and your chamois. Nothing should roll or pucker. It's going to be uncomfortably tight. That is what you need, because anything that can pucker will grab your skin and create irritating spaces. Also, you gotta kind of try, I hate this, but you have to try a few. They have all different levels of padding and support. There are some that I go numb after 15 minutes because it's not the right chamois for me. So you might have to try a few. Then connective tissue stuff, I see hypermobile people, usually women, and my job is very important in creating a limitation where they can extend further, but I won't let them, because if they do, we're putting too much pressure on those joints and we're going to create an injury because you can't sustain strength at that hypermobile state. So my job is mostly saying, no, I know you want your saddle higher. We have to come down. We have to stay here. I know it's uncomfortable, but this is where we're going to build muscle and then support you and prevent injury. Yeah?
And I do see hypermobility issues in general. Usually it's after some sort of injury, but that's also a good population to do preventative work as well.
Okay. Oh, okay.
Sorry, I had a couple questions, one for each of you.
Ooh.
So I know people who have gastrointestinal diseases or disorders, I've heard they're more likely to need pelvic floor or have pelvic floor dysfunction. Is that accurate?
It can be. It all depends. Usually people with GI issues are in the bathroom more, or, they're too much going to the bathroom, or just constipated in general. So that's the chicken or the egg thing again. It could lead to more pelvic floor issues, or the pelvic floor in general could have started some of those issues. So yes, that could be.
My question is an upright bike that's designed more for comfort, can that be better for the pelvic floor than bikes that are designed for
So it's all going to depend on, one, can the touch points be where you need them to be? Two, can you train your body into that position? Your muscles, just like sitting up, you need muscles to sit up. Everything is about what your body can adapt to and then basically hold strong, and what you want to be doing. Some people don't want to train into this position. That's fine. You don't have to. But I never want to tell someone that they have to be upright because they're experiencing pain, because usually there are other things happening that we need to address. Yeah.
Do you have any advice for people who might want to help spread the word? We're bike shop owners and people in this room, of having clinics, anything that you think, aside from having a properly educated guest speaker, someone to support with good information, anything like all one gender or another at different sessions, or anything like that that would make this information more accessible?
I have a couple ideas.
Yeah.
Can I?
Yeah, please.
One would be having a screening sheet like this, and have it clear that you're not the one who's going to address this. This is who you would recommend. Be like, if you were my sister, I'd recommend you to this person, and hopefully this helps you. People like when they don't have to necessarily look at you and talk about it, but you could say, oh, here, take this, and if anything piques your interest, we really trust these people. That's
a good, yeah.
That's
great.
One big one. Do you ever do any clinics? like open house clinics?
No. No, I don't, but I could.
If you do, I would probably pair it with something like, hey, we're gonna do an afternoon where we have pizza, we chat about pelvic floor, and you can see our new saddle wall or whatever it is. Kind of incorporate it with some other things, make it a little friendly, so it doesn't have to be quite so pointed. We've certainly, at my shop, we've done a few things where we kind of try and make it something that isn't just the one thing. Yeah?
I bet you if you bought one of those pelvis models and set it on your counter, you'd get questions. I mean, yeah, but I was just thinking about that when you said that, and then you get the discussion going.
I have a 3D printed clitoris in the shop, yeah. I have a pelvis, I have a knee, I have a foot, I have a 3D printed clitoris, because the full mapping of the clitoris wasn't done until, 2008? Oh, it was either 2006 or 2008, and it's much larger than everyone thinks, and it sits in, and it helps me tell people that if you're feeling discomfort, even back here, that it's the clitoris, and you have too much pressure there. It kind of like livens things up. All right. Oh.
What riding position would be best for a weak pelvic floor?
Oh, so again, I think that I'd want to see your stabilizers. I'd want to see kind of what your spinal erectors were doing. I'd want to see the rest of the puzzle that is you. I was saying before, it's like gathering puzzle pieces to see what this person is and what they need. And that's when I could start working with someone. Do you have any blanket, what you think?
Well, my bike knowledge is terrible. But there's many ways to strengthen your pelvic floor so that you don't have a weak pelvic floor anymore. We could start on that end, and then take a look at the fit on your bike.
For her question, would you ever recommend a recumbent bike, or do you think that's a cop-out?
Here's the thing. If you're experiencing something that is limiting you, I don't want to say, okay, well, you're not going to do that anymore, so I'm going to put you on something else. I'm going to say, you are active and you are mostly healthy. Why don't we work on getting you all the way healthy and give you what you want? If she wanted to be in a recumbent, sure, I can make that happen. But I'd much rather look at the whole athlete and work with the whole athlete and try to take what you want and support you. So I would probably want to see you a few more times. I'd recommend a level of fit that has more follow-ups included, so that we could kind of work our way into it. Yeah, I think this has to be our last question, and then we'll be here for a few more minutes too, but I know they are gonna want the room.
Just really specific to, I guess, your shop, et cetera. Do you work with a bike that a person already has?
Yeah, we do a bike that you already have. We also do, if you are looking for a new bike, I can give you options for stock bikes, and also we do custom bikes. Thank you guys so much. We did it. You're welcome.